Here's how to use your action potential machine to treat a shoulder, and the same principles apply for other large joints like the hips. So we always imagining the current going in a straight line through the worst area of pain. So the pain is within the shoulder here in this example. So we're going to put the black electrodes at the front. They could be at the back. Sometimes you can ask, well, is the pain worse at the front or is the pain worse at the back? Now, if the pain's worse at the front, use the blacks on the front. If it's worse on the back, use the blacks at the back. But it doesn't really matter as long as the current's getting through it. So we're going to put our black electrodes, that's lovely, at the front. Now, if the pain is radiating down the arm, then you could have another black electrode here. If the pain was radiating more up this way, then you could have another black electrode here. It's nice to try to use both sets of electrodes because we're just getting more treatment then. The main principle is that the red electrode is going to go bang opposite the black one, creating the shortest journey for the electricity to take. So electricity will always take the shortest route. So if I was to put my electrode too close on the skin, then it would just go around the outside. And this is why going through the body only really works on these big joints. So we've got black at the front, red at the back. And then in this case, we're going to go and put another electrode at the front, just at the front of the armpit, and the red electrode at the back there. I'll just show that here. Okay, and then exactly the same principle. Turn it, make sure it's off to start with, then turn it to on, then tell me when you feel the tingle, turn it to up, clockwise. No. Okay, so that was round about 0.40. I'm going to leave it about on 1.13. Okay, and that will run for 8 minutes and then turn itself off. Now, when it turns itself off, our third placement, so we've done one placement which is down the spine. Our second placement has been like this. Our third placement, when it beeps, it could be that we think, yep, we've just about nailed that we can't get a better placement than that. Let's leave the electrodes there. Or it could be that we want to try attacking the pain from a different angle. So let's try that. I'm going to just turn it to off at this point. We could decide to go across the whole of the shoulder area. And we could do that by having, do you mind just turning? So that's it, lovely. By having our electrodes running from one side, in fact, let's have it right on the edge of the shoulder, from one side of the body to the other side of the body. If somebody's got pain in both shoulders, this could be helpful. So now the current's going to be running from the blacks to the reds, and obviously that would be helpful if the pain was felt kind of maybe muscular a bit lower down. If in actual fact the pain was more like up here, then you might actually want to think about making a line that went like this. And just going across. So same principles again, and then it will run for 8 minutes and then it will turn itself off.